Welcome. We are going to be talking about clinical consultations, how you can level up your services and protect your practice. I'm Dr. Kathryn Esquer, and let's get started. So first, we are going to go over why clinical consultation should be a part of your practice. We are then going to move on to how to know when you need a clinical consultation, as well as how to ethically conduct a clinical consultation. And last but not least, we're going to talk about how to add clinical consultations as a paid service in your practice to increase your revenue and create another stream of income. A little bit about myself. I have a doctorate of clinical psychology as well as a master's in business administration. But currently I work as a clinical psychologist in my rural hometown in Pennsylvania. I absolutely love serving the community there. But it was a little isolating. I don't have many peers in the mental health field to consult with. We're an underserved population in my community. So that actually led me to create the Teletheapistt Network. I founded it in the middle of COVID, and we are a private consultation group of licensed therapists who provide support, resources, insights, and consults with each other so that we can level up our practice, our clinical outcomes, as well as prevent burnout and isolation in mental health. I've always had an interest in telemental health. I started working towards my board certification as a telehealth professional in I think 2017, I believe I started it, and continued all the way up through the pandemic. So I have been working and learning in this field for a while. I am also a proud mom and wife. I have 2 toddlers under the age of 3 now. So it's been a wild ride over the past year. And I'm also, for fun, a registered yoga teacher, even though I actually have never taught yoga. I do it for myself. So it's a little bit about me, and clinical consultations have been a particular interest of mine, not only in graduate school, but also after graduate school, when I found myself needing the support of peers and the insights of peers to help me practice ethically, safely, and improve my clinical outcomes. So I'm really excited to share my knowledge and my experiences in clinical consultation with you today. So before we get started, I'd really like you to think about the first word that comes to mind when you hear clinical consultation. We might already have some ideas and perhaps some biases or assumptions about clinical consultation. So let's kind of bring that to the surface and see what we're working with. If you're not watching this live, maybe get out a notebook and jot down some stream of consciousness of what comes to mind when you think of clinical consultations. When you're ready, let's move on to the next slide. We're going to talk about who needs clinical consultation. So you're here today and watching this, hopefully because you know that clinical consultation should be a part of your practice, but it should be no shock that there are some of us out there who just don't prioritize peer consultations. So just to clarify, who needs consultations? Well, all therapists. Every single one of us needs to have clinical consultations as a part of our private practice. But the question is why? I'm sure you're asking, well, why do we need these, right? Well, first and foremost, our ethical guidelines require us to regularly consult with peers in order to maintain an ethical practice. I'm talking about all the major organizing bodies here. American Psychological Association, National Association of Social Work, American Academy of Counselors, AAMFT, all of these big organizing bodies, and the ACA as well, all these big organizing bodies, they require us in their ethical codes to consult or to have consultation with peers as a regular part of our practice to maintain ethical standards. So yes, this actually means you could be brought up on ethical complaints from one of these organizing bodies for not seeking regular consultations. So it's an important part of our practice, and all of these organizations recognize it. We need to be talking about it and making it easier for us to consult with each other because it's part of what we do and how we do it best. So why? Why do all these organizing bodies? Why am I sitting here saying we all need to consult as therapists? Well, if you remember back to graduate school, I'm sure you remember hearing, you don't know what you don't know. Or in other words, the blind spots. All of us have blind spots. We're humans, right? So we need to use clinical consultations as it is the primary mode to point out what we don't know, how we begin to learn about what we don't know. It's impossible for us to know everything at all times, like the best clinical practices, the most recent research coming out, perhaps different treatment modality options, clinical populations and the nuances of working with those, as well as, most significantly, the changing ethical and legal standards in our fields. It's fundamentally impossible for us to know it all. So what peer consultations do is they allow you to crowdsource or to get other people's input and get other people's experiences. You know, perhaps you consult with someone who doesn't have the same license as you do. They're getting different information that maybe you weren't aware of, the research coming out of the counseling field, because you're a licensed psychologist. We need to be aware of all of this research, and using our peer network, our peer support, and peer consultations can help make that efficient and effective. Additionally, you're gonna want to check yourself, because healthcare is a human profession and consultations can help us do that. We bring ourselves and our judgment into our work. We all have biases and blind spots, like I just mentioned, but we also all have transference and countertransference happening in the therapy room, and that can influence our work. So just like therapy provides a mirror for our clients to see themselves, their thoughts, their behaviors, and their history more clearly, peer consultations provide us with a mirror to see our work more clearly, to see our biases, to see what we bring into the therapy room and what we're taking out of the therapy room more clearly. So in addition to relevant legal and clinical standards of care, it should be part of our practice, because it is best practice to seek clinical consultations. Practicing teletherapy alone, or as I call it, in a silo, can be risky and dangerous. We don't know what we don't know, and we need to be on the lookout for improving ourselves, our work, and our clinical outcomes. As I mentioned earlier, you can be brought up on ethical charges or complaints for not adhering to the code of ethics of your organizing body. So since all of these require consultations as a part of our regular practice, we really should be doing so to prevent any type of complaints about us. But in terms of legal standards, different than ethical complaints, ignorance or lack of awareness isn't a defense. I've tried it a couple times with speeding tickets. I didn't know the speed limit in this area, officer. I'm so sorry. And I still got the ticket every single time. So, you know, clinical consultations help us reduce the amount of knowledge we don't know and keep us up to date. So by engaging in clinical consultations, we could actually be avoiding any type of missteps or any outdated practices that could be subject to legal proceedings. Additionally, if you're ever caught up in any legal proceedings, seeking quality and regular peer consultations can show that you took reasonable steps to provide quality care. I want to clarify that nothing is a bulletproof defense, but consultations can certainly help you avoid legalities by helping you provide quality, ethical services, as well as support you if you're caught up in one. Okay? So there's no better defense than a good offense. So let's all be not offensive, but let's all put our offense on and go out there and get those clinical consultations with peers before we're in a situation where we're saying, oh man, I wish I did that, right? And from the hangover, you better check yourself before you wreck yourself. So how to know when you need a clinical consultation? So first and foremost, before we get into how to know, let's clarify the difference between consultations and supervision. Sometimes people use them interchangeably, but they are different. They are actually very different, fundamentally different. Consultants offer their opinions and recommendations to their consultees, but the consultees, so the person receiving the advice, they retain control over all of their decision makings. They retain responsibility for their clinical case. They have the option of following, modifying, or completely ignoring the recommendations of the consultant. And that's the consultee's decision. There is no responsibility for the consultant to enforce their recommendations, right? So, and the legalities or the liabilities, excuse me, of the case do not fall back to the consultant. They still remain with the consultee because decision-making and the clinical care remains with the consultee. In contrast, though, supervision is a hierarchical relationship where the supervisor actually has control and authority over all treatment decisions, and the supervisees should not and they cannot modify or ignore the decisions of their supervisors. So in this case, the supervisor assumes full responsibility for the case, and the supervisee needs to follow the supervisor's direction. So, as you can see, they're very different, right? The consultee retains autonomy over their case while the supervisee does not, okay? So let's not use these interchangeably. Peer supervision is not peer consultation, okay? And you really do need to be speaking of this correctly when setting up a consulting arrangement or seeking consultations so that we know who retains control and liabilities of the case at hand. If it's retained by the person receiving the advice, then it's a consultation. If the person given the advice assumes responsibility for the case and signs off on everything, then that is supervision. Okay, so let's make sure we understand the difference and use it appropriately, because you need to know what you're looking for. If you're pre-licensure, you're not looking for consultations, you're looking for supervision. And if you're post-licensure and you're just looking for some additional help or additional training, maybe to expand your services or to check yourself and make sure you're providing the right amount of care, you might not be looking for supervision. That's more of a consultation, okay? And consultations could be short-term, once, or ongoing. So we'll get into that a little bit later, but let's make sure we know the difference. We're talking about consultations here. So the most talked about reason for seeking a consultation when you're providing clinical interventions is when the clinical intervention is outside of the population that you're normally working with, or it's a new intervention to you that you do not have a lot of experience, knowledge, or training in. So competence is based on education, training, supervised experience, study, professional experience, all of these things. And what this really hits home is there are two pieces to this statement. One is clinical interventions outside your competence. You should be seeking consultation. And two, populations outside your competence or experience. You should be seeking consultations. So that means if you maybe are very, very skilled in working with geriatric populations, but you have outdated or inadequate experience conducting exposure therapy, even though you're very familiar with the population, the geriatric community, you should be seeking consultation on exposure therapy to make sure that you're approaching it ethically and responsibly. Okay, and then conversely, if you're a pro at anxiety disorders, including exposure therapy, but you've never had experience or supervision or training in working with the LGBT community, you should be seeking consultations with an expert or someone trained and very experienced with competence in helping the LGBT community, because you do not have experience or competence with this population. So both scenarios that we just went through require consultations for ethical practice. So there's also other indicators that support the need for consultation. And this first one comes from the National Association of Social Work. And this is a very general statement, but you should be seeking consultation whenever it is in the best interest of the client. So this could cover a wide variety of situations. But for example, I was working with an individual with OCD, and I was competent in making the interventions to treat OCD, and I was competent in this individual's population. But, you know, the case wasn't really making as much progress or really any progress like I thought it should. So in that situation, it was in the best interest of the client for me to seek consultation because I wasn't sure why we were stalled or why we weren't making progress. So seeking consultation as to why what was happening or how I could be more effective, that would benefit the client. So that's a situation where it was in their best interest for me to seek consultation. So additionally, the American Academy of Marriage and Family Therapists also states in their ethical code that we should use consultation to evaluate your efficacy as a counselor. So this standard actually implies that even if you're competent and making great clinical outcomes with clinical interventions and populations that you're competent in, consultation should be regularly used to gauge your efficacy as a clinician so that you can help identify blind spots or areas of improvement, even in the absence of an issue or a barrier to treatment or a question. We should be doing this regularly as part of our practice, even when we're not faced with a question or issue. And last but not least, you should be seeking consultations anytime you want. Nothing is stopping you from seeking consultations. If you feel like something changed in the therapy room or a different type of vibe, or even you just want to talk to someone about the case, and need a personal checkup on it, let's normalize and make it a regular part of our weekly and monthly practice to seek out these peer consultations. So hopefully those standards, even though they're very large, they really hit home the fact that we should be making this a part of our practice. And also we should definitely be seeking consultations in very specific examples, like when we're not competent in a certain working with a certain population or with a certain clinical intervention. So I would love for you to think about maybe where are your go-to places that you can find your own clinical consultations in your practice or at your work right now. Where can you go to find these? What peers can you lean on? What organizations are you a member of? I know that, I run the Teletheapist Network. We have live consultations all the time. So I go there for those consultations. They're part of the membership. So I use them all the time to be able to even just listen in on what other people are learning or offer my guidance and my experiences. So think about your own network and your own communities. Where can you go to find clinical consultations? We're going to talk next about how to offer or conduct an ethical clinical consultation. So first, I referenced this earlier, consultations can be a lot of different things, okay? It's not just a one-time talk. It's not just a formal engagement. They could be one-time or ongoing, right? You could be talking to a peer, you have a quick question about a case, or it's a one-time session, or maybe you're looking to expand your services to a population that you don't feel competent in and you're not competent. Maybe that requires more of an ongoing, a couple months of regular consultation to make sure you're practicing ethically. So they are definitely not one or the other. They could be one time, a few times, a long time. They can also be paid or free. I don't think anyone would think about charging one of our peers for saying, hey, what would you do about this case? And it's a couple-minute conversation or a half-hour once. But there are situations where experts in the field can offer paid consultations, and we'll get into that in a couple more slides, for people looking for more in-depth or more ongoing consultations. They can also be formal and informal. A lot of times, like I said, you consult with the peers you have around you, right? If you work in a situation where you have colleagues in the mental health field, unfortunately, I did not. So I missed that. I missed being able to walk down the hall or send a message to one of my colleagues and say, hey, what would you do in this case? Or, hey, I'm feeling really weird about just leaving this session. Can we debrief? Those are really informal consultations, but they are consultations. Or they could be formal with a written agreement and clear rules and expectations. They can also be simple or complex. So the simple request for straightforward factual information, that's pretty simple, but consultations can get even more complex. And if you are the consultant and you're offering your consultation advice or recommendations, they become more complex when the consultee maybe isn't aware or even willing to provide a standard of care that you feel is a bare minimum. So the highest level of complexity involves cases where the consultee is unaware or unwilling to accept the legal or ethical issues that are going on and could be resistant to learning basic information about the case. So not only are consultations about the client, but they're also about the client and consultee relationship. So that gets very complex. It's very similar to the supervisee and supervisor dynamic. dynamic, but without the hierarchical nature, excuse me. So let's get into how to conduct an ethical consultation. First and foremost, it is imperative that we qualify the person offering the consultation. If you remember from earlier, the consultee, if I'm looking for advice or recommendations, I still retain the responsibility to determine whether the advice is worthwhile to accept and take, to modify in this situation, or to reject and ignore. I retain all control and clinical decision-making of the case. The liability still lies with me. So with that comes, it is my duty to make sure that the advice and the consulting recommendations that I'm receiving are coming from a reliable, trustworthy, credible, competent source. Where I see this most come up is on Facebook groups and large forums where I pose a clinical question, I remove all PHI, so there's no HIPAA violations, and I pose a clinical question and I get any number of responses. Great, I have a great number of responses to choose from, but I don't know where they're coming from. I can't qualify, most likely, where they're coming from, who's giving it, what their qualifications are, what their training is, why they're giving that advice, what qualifies them, are they even competent in giving me advice in this particular area or this situation. It's very, very hard to qualify the consultant or qualify the person giving the advice in these large or even small Facebook groups. You really want to make sure that you're able to make sure that this person giving the piece of advice or the consultation, again, they could be brief and informal, like on Facebook groups. Do they have the experience, training, and education to be competent or qualified? It is completely reasonable and appropriate to ask for a CV or LinkedIn profile of someone offering you a consultation. Now remember, we still retain full legal and ethical liability for deciding whether to take or not take, not follow, disregard these pieces of advice. And we need to have a sound reason for taking or disregarding this advice. Okay, so Facebook groups are not appropriate to seek consultations on because you can't qualify the piece of advice. Just that in itself makes it completely too risky to be able to offer consultations or to ask for consultations on these Facebook groups. Okay, so I highly recommend you think about your own communities. You don't necessarily have to go to people that you already know and trust. You can ask people, you can ask for recommendations, someone who's great at exposure therapy or treating OCD. Hey, you know, who can I connect with and really get to know them and make sure that they're offering me advice from a competent and qualified viewpoint. Okay. So that's the first point of conducting an ethical consultation. You want to make sure you qualify the consultant. You also might want to think about an agreement letter. If you're working with someone for more than one session or a very extended session or a very specific, perhaps, situation that you want to make sure you document, an agreement letter could be you can think of it as an informed consent to consultation. It doesn't have to be as formal as an informed consent to treatment or therapy, but you should agree upon the rights and responsibilities of each other, which should distinguish consultation from supervision. And you should agree upon any fees, have a contingency clause where either party can discontinue the consultation. So depending on the formality, you maybe want to get your agreement letter in writing, or not all the time you need an agreement letter for consultations. If you have an established colleague, you know, a verbal agreement could be as simple as, hey, can I borrow half an hour of your time to get a consult on this case? It could be very simple, but agreement letter or an agreement of sorts should be decided upon. Both parties want to understand that they are in a consulting relationship or a consulting situation. Again, these Facebook groups, it's not, you don't know necessarily who's replying to you, where they're coming from. And also there's no real formal or even informal assumption or agreement of the consulting relationship, okay? So agreement letter, or again, verbally would be useful, and you should do those for an ethical consultation. Second, you want to make sure that the consultations happen in a private and confidential environment. So think about this as the consultation should happen in an environment as closely resembling the privacy and confidentiality as a therapy session. So this could involve meeting in person in a quiet and secure place, but this could also mean meeting on a video conferencing system that's HIPAA compliant, like Google Meet, Professional Zoom, Doxy.me. Unfortunately, FaceTime is not HIPAA compliant. We should not be using those for clinical consultations with peers. We all should have some type of video conferencing available to us. Doxy.me is free and it's great uses for clinical consultations as well. Following up on privacy and confidentiality, even if you are conducting these in HIPAA compliant environments, you should still disclose the least amount of PHI necessary. Okay, so disclose the least amount of information about the case and the client necessary to achieve the purposes of the consultation. You most likely will have to disclose some pieces of identifying information to the consultant to be able to get the full picture and get the best piece of recommendation or advice possible. Okay, so, but you want to withhold information, PHI, that isn't necessary. The consultant probably doesn't need to know the client's name, but they might need to know their age range or their profession. Okay, so APA actually allows us to consult without a release of information from the patient if you don't exchange identifiable patient information. However, we are still held to the laws of our license in the jurisdiction in which we practice, and it might differ from the recommendation from APA. So best practice is to check with your licensing laws to see what they allow for clinical consultations, whether an informed consent from the patient is necessary or not. It is definitely useful to include informed consent to consultation or the permission to consult with qualified peers in your informed consent to therapy. A lot of us already have that in there, but you want to make sure you discuss what consulting with peers means to your client so that they can make an informed consent. They need to know what it means or what it looks like for you to consult with peers or peer consultations, and not just have them sign the informed consent to treatment. Really explain to them what consultations are, how you will have them in secure and private locations, how you qualify the consultant, how you disclose the least amount of PHI necessary. And again, when we're thinking about our clients and their privacy and confidentiality, these informed consents that include clauses about peer consultations, that does not include posting a a post in a large Facebook group with thousands of members. That is not covered under allowed peer consultations and informed consent to therapy. Okay, so make sure that you are doing these consultations just like we're talking about here, not in large group formats for thousands or hundreds of people to see. That's not appropriate, and that could be a violation of privacy and confidentiality from your patient. Okay. Last but not least, we are going to talk about documentation. So documentation for consultations is not necessarily required, but if you are going through an ongoing consultation arrangement where you're extending your services or extending your competence in a certain area, or you have a very specific question, you might want to think about keeping documentation of the consults. And this could be a part of, if it's a one-time situation or a very specific situation to a client, this could be part of the client's chart, the consultations, or you could have even a dedicated area or chart just for your consultations. If perhaps you're working on extending, your services to children and you're looking to build competence in that, maybe you have a consultation chart for an ongoing relationship with a consultant there. If you do keep documentation, though, you want to treat these documents just like clinical documents and follow your state laws on how long to retain them, how to keep them private and confidential, and again, include the least amount of PHI necessary. Okay, so documentation may or may not be appropriate depending on what you're consulting on, but it is up to you to decide. And if you do decide to document, make sure they are secure, just like your clinical documents. So I want you to think about We're going to move on here to our last topic of offering paid consultations as part of your practice. I would love for you to think a little bit about what topics can you offer for paid consultations. This could be maybe your clinical expertise. Where do you have a lot of training, experience, past supervision, you feel up to date on, and you are competent in the areas, in the ways that we discussed earlier. Or maybe where are you really strong at knowing the ethical implications and standards for your licensing and your organizing bodies. Or perhaps you're very strong in legal situations or legal requirements for your license in your state or jurisdiction. So think about some areas where you're really strong that you might be able to offer paid consultations, and we're going to talk about how to do that ethically. So we'll be going over a checklist for paid consultations, and they can be a really great revenue stream for your private practice. However, offering paid consultations are not as easy as just adding another service to your website. You really are going to want to think through and have a few things set up before you can offer paid consultations ethically to your peers, okay? So like we mentioned earlier, first and foremost, you and whatever consultants or consultees, you take on, so you're offering advice or recommendation to, you both should understand the differences between consultation and supervision, okay? Consultants do not sign off on clinical notes, The consultees retain full liability and responsibility for their clinical cases. And supervision is very different. Again, hierarchical relationship where the supervisee retains clinical decision-making. Okay, make sure we understand that. We're not signing off on notes to get higher insurance reimbursement as a consultant or offering consultations. That's a supervisory relationship. So make sure we are all in agreement, we all know. You also want to identify and resolve any influential dual relationships. So similar to documentation, there isn't a hard and fast rule on this. So you're going to want to be thoughtful about a consulting relationship. Some of the best consultations I received were from really close friends or colleagues of mine who knew me and my clinical skills and clinical tendencies very, very well to be able to give me really great advice and recommendations. So you can have consulting relationships among friends or colleagues, but it's important to identify and think through any dynamics or history between the two, the consultant and the consultee, that could impact the objectivity of the consultant or the consultee. So the whole consultation, you want to make sure both parties can remain objective. The consultee can remain objective to the recommendations coming from the consultant, and the consultants can look at the consultee and the case objectively. Make sure that those things are resolved if there are any, and maybe, if there are some pretty interesting dynamics, you might want to think about maybe finding someone else to consult with, or asking your friend or peer, hey, who else might you recommend who as an expert, whose expertise is like yours, okay? So you also, again, want to make sure that you qualify yourself as a consultant. You want to make sure that you are ready and capable of offering paid consultations. And we're going to look at 3 things that you should be thinking about before offering paid consultations for yourself. You want to think about your own knowledge, your skills, and your attitudes. So first and foremost, knowledge. You need to make sure you have the knowledge relevant to any cases that are coming to you for consultations. Not just clinical knowledge, so your specialty, your expertise, but also relevant laws and regulations around the case. So for example, if you are an expert in trauma and child abuse, but a potential consultee comes to you and they're in a different state, you might want to refer them out or say no to the potential consulting relationship, because you might not have the knowledge of those state laws for child abuse, the reporting laws. You want to make sure you know clinical, you have expertise in the clinical area, but also in the laws and regulations. Okay, consultants need to acknowledge their limits, and they need to know when to say, I don't know, or you should maybe get a different consultant who has X, Y, or Z that I don't. You should be comfortable making a referral when the ethical or legal issue is outside of your expertise. This is especially true when consulting between different jurisdictions and because of the limits of knowledge on applicable laws and regulations. So make sure that you're thinking through the case as a whole, not just through the intervention or clinical lens. So secondly, you want to think about skills. And by skills, I mean your interpersonal skills or your consultant skills. And we'll go over what this means. It means being able to deal directly with a consultee who may be anxious or distressed. Consultants should be able to build rapport and trust with their consultee so that they can work on the case together, encourage the consultee to challenge their opinions if they choose, and also be able to point out blind spots or missteps to the consultee in a way that allows the consultee to approach them with openness and reflection and acceptance. So overall, effective consultations are collaborative, and they really facilitate the consultee to think through the reasoning and clinical opinions in an open and honest way. And that does involve building a very good rapport, maybe even quickly, and a trustworthy environment, in a supportive environment, and helping the consultee work through any distress or anxiety that might come up. So an important note when we're thinking about offering paid consultations is that our ethical codes don't necessarily mandate reporting of substandard care on the part of the consultee. So if someone's providing, if a consultee comes to us and they're providing substandard care, we definitely want to make sure we keep the client's interest first. So we want to make sure that we help them take steps to reduce potential harm to the client. So, however, we're not mandated to report this consultee as substandard care. The difference is if they are impaired practitioners. So impaired practitioners, for example, in the case of substance use or abuse, when we have an impaired practitioner who is causing harm to patients, we need to refer to our licensing and jurisdiction laws about mandated reporting of impaired practitioners. So keep that in mind, and you want to be familiar with what those laws and regulations are for your license and for your jurisdiction before offering paid consultations. Think through all of these, have them written out, know what you're getting into and what you should be looking for. Last, when we think about offering paid consultations, thinking within ourselves, we want to make sure we have the right attitude going into it. Like I mentioned earlier, it needs to be a collaborative relationship. And we also have to recognize it's not hierarchical in the sense that the consultee has to take our advice. So consultants need to remember that they do not have ultimate responsibility for the case, and we need to be able to accept our limited role. Consultees can choose not to follow our recommendations, and we have to be okay with that. I like to use the phrase, this is what I would do in this situation with my consultees. And we might not use that phrase in therapy, but using it in consulting relationships allows us to verbally respect that the final decision lies with the consultee. So we make sure we have the right attitude going into these relationships or these agreements. If you're choosing to offer paid consultations, last but not least, you wanna, like we talked about earlier, draw up or have something in place like a contract or an agreement letter. It doesn't need to be complex, but it should definitely include the purpose of the meeting. For instance, I'm offering consultations on clinical areas, or I'm offering consultations on these ethical areas, the limits of confidentiality as required by your license, and any fees involved. And like I said earlier, this agreement letter should definitely distinguish the difference between how consultations differ from supervision so that all parties know where the ultimate decision making lies, and that is with the consultee. You also might want to include a clause about termination. Usually it's helpful to have one that either party can terminate the relationship at any time. And this is useful on our part as offering consultations or being the consultant, that if our consultee is offering substandard care in our opinion and not following our recommendations, we have the right to terminate the relationship. So I hope that gave you a little bit of insight into what consultations are like, how to offer them for your private practice, why they're necessary for your private practice, and how, us regularly consulting with peers can help us, one, maintain a really good quality of care, level up our ability to produce great clinical outcomes, increase our self-awareness, and just help us be overall good mental health clinicians. The world needs good mental health clinicians right now, and training is not enough. We need to be doing ongoing reflection on our work, again, to look at the efficacy, to make sure we're being the best clinicians we can be. And also, just from a personal note, peer consultations can provide us with some validation and support that maybe we're not getting, or we can't get, because we can't go to our friends and family to look for validation and support for our clinical interventions, because we'd be breaking confidentiality. These are safe spaces where we could really get the support that could prevent burnout or isolation in our field of mental health practitioners. So thank you for joining me today. Again, I am Kathryn Esquer, founder of the Teletheapist Network. If you are looking for a group for consultations, check us out. We're at www.teletheapistnetwork.com. Pretty easy. We are accepting membership applications right now for a limited time. We are a capped small group, and we have weekly consultations live on video, so you can really build those relationships, qualify the consultant, and get to know your peers on a deeper level. So thank you again. I hope you enjoyed this and you learned a lot. I am at Kathryn@teletheapistnetwork.com. If you want to shoot me an email, I am always open to connecting. Again, I love building relationships. So thank you, and I hope to see you on the Teletheapist Network. Bye.